Coming up on this episode of the Concussion Game Plan podcast.
Depressive symptoms and anxiety symptoms are something that we absolutely see kids experiencing, people experiencing after concussion.
Hey everyone, it's Dr. Chris Nowinski, co-founder and CEO of the Concussion Legacy Foundation. Welcome to episode 4 of the Concussion Game Plan podcast. I can't wait for you to hear our conversation with Dr. Christina Master explaining the emotional symptoms of concussion, what they are, why they happen, and how they are treated. You'll also hear from a former Division I soccer player who struggled emotionally after his concussion. He joins us to share what helped him most along the way. Here on Concussion Game Plan, we want to give you the information you need to set yourself up for a complete recovery, but also to prepare you and your loved ones for the challenges you may face. Most of all, we want you to know that you're not alone. Let's dive right in.
And just a producer's note, Noah's recording took place while he was on the sidelines of an early morning soccer practice. So just a heads up that there are extra background noises in his interview. We apologize if you find them distracting. Here's Dr. Master.
People commonly will think about depression or anxiety as being symptoms that you can experience after concussion. But in younger kids, we actually often will see, a whole wide range that can be kids acting silly, kids acting very, frustrated easily and having irritability.
Dr. Christina Master is a professor of clinical pediatrics at the University of Pennsylvania Perelman School of Medicine and the co-director of the Minds Matters Concussion Program at Children's Hospital Philadelphia. She is the only pediatric sports medicine specialist with a subspecialty in brain injury medicine in her region, and the perfect person to walk us through the emotional symptoms of concussion.
The depression and anxiety sometimes can be related to the situation where they're not involved in the school and activities that they're usually used to being involved in. But we do think that there is also very much just a biological injury component that just causes you to have a biological experience of depression and anxiety. So it can really run the entire range in terms of emotionality. And probably lability is one of the main characteristics of all of them, that no matter which emotional symptom you're experiencing, it can be a little bit of a roller coaster experience.
If you feel like your emotions are all over the place after concussion, that roller coaster experience Dr. Master describes, you're not alone. Know that it's normal to be feeling a little unstable.
Your brain stamina and your brain energy is really not what it's usually at. Teenagers, kids usually are like Energizer bunnies, and they have loads of brain energy, brain stamina, cognitive stamina. And so when you have a concussion, all of a sudden you have very low levels of what feels like cognitive stamina, then everything can really become an issue in terms of not being able to handle or cope with situations. And so being able to be on an emotional even keel may be very challenging. It takes a lot of cognitive energy that you just all of a sudden don't have. And so then issues like depression or anxiety can set in. Certainly, frustration and inability to cope with stress, are related to those cognitive stamina issues. And really the cognitive stamina translates into emotional stamina, essentially. And so if you think about it developmentally, even from an early childhood standpoint, what kids are doing in their preschool years is learning how to control their temper and their feelings and have a little bit of self-control for that. And that requires energy, both cognitive energy as well as emotional energy. And if that is all of a sudden lower after concussion, that's definitely, I think, contributing to why emotional symptoms occur. We do think that there's a biological reason, too, that we just don't understand yet entirely in terms of what happens after the injury and the biochemical changes that happen in your brain.
And the best way I could kind of describe the anxiety also with the physical symptoms of headaches and things was just feeling like you were in an overdrive mode where your hardware is just like out of memory. That's kind of how I felt at the end of the day, or like 3 or 4 o'clock came and my headache and my physical symptoms were so high. I felt like my brain was going to explode, but I also had this overwhelming anxiety and like pit in my stomach and in my chest that it literally felt like my whole body and my mind was in this overdrive mode where like my computer was about to crash.
Noah Abrams was playing in goal for the Northeastern University men's soccer team during a September 2018 game when he collided with an attacker's knee. He was knocked unconscious and rushed to the hospital where doctors put 18 staples in the side of his head. In the weeks that followed, he struggled with increased sadness, anxiety, and irritability.
I would say in general, I'm not a very irritable guy, like go with the flow kind of dude. At least that's what I think. Maybe my friends or family wouldn't describe me as that. But I remember being in class probably a little bit too soon after my concussion, probably 2 or 3 weeks. And when people used to open their food containers, whether it was like wrappers or sandwiches in class, that used to always frustrate the hell out of me. Like just hearing the sound, and I would always think, why can't you just open that faster? Like, why do you have to open that right now? So I remember those little things used to really frustrate me. And even sometimes like the clicking of the remote or the closing of cabinets. When I got home, I remember I kind of flipped the switch a couple times with my mom because I felt like she was closing the trash can too loud. And obviously looking back at it, she wasn't at all, but just the sound of the trash can like closing every single time throughout the day used to bother me so much. So I would say, yeah, it was definitely an irritable thing, but it was also a combination of the emotions and the physical symptoms. I would say kind of that's when the concussion recovery gets really, really hard, is when your emotional symptoms and physical symptoms kind of start to collide with each other.
Sometimes after concussion, you feel off emotionally, but aren't able to put into words what has changed about you.
To be honest, I think one of the most enlightening things that one of my patients told me was a 10-year-old little girl. And you'll be surprised, many people might be surprised that we screen every child in our practice for depression or anxiety. So when I asked a 10-year-old if she felt sad or worried or down or depressed, she kind of looked at her mom, like, was it okay for her to tell me? And her mom said, go ahead and tell Dr. Master. And she said, I'm sad and I don't know why. And it was interesting to me because I really felt like that kind of captured that biological depression aspect, because I think we often, as adults, teenagers, will attribute the fact that we feel sad because of a reason, right? We feel sad because we had a concussion, we're not doing our things, we are anxious because we're worried or we're stressed. But there's absolutely a biological component to this. We are biological beings, and so I think that there is that biochemical aspect.
I obviously felt very emotional, anxious, and depressed from the kind of traumatic experience, but also there were certain times, even in that moment, I couldn't directly pinpoint or point out why I was feeling sad. I just had this like overwhelming amount of sadness and tears, and it was very uncontrollable. Like it just came and went whenever, and I couldn't like decide and hold it in. Really, from that moment on, my emotions really always got the best of me, and they just kind of just came and went at the most random times.
I asked Dr. Master why some people experience emotional symptoms following a concussion, while others do not.
That is a really, really great question. I think that we only have a partial answer to that with all the research that's been done. I think that there is a lot that people have, been looking at in terms of, if you have a pre-existing condition like depression or anxiety before you have a concussion, or even a learning disability or attention deficit, disorder, that may get worse after concussion. And so that kind of makes sense to folks that could happen. But that's not 100% the case, to be quite honest. And so I would say it's just, as frequent, anecdotally in our practice. And certainly if you look at the literature out there, the data is very conflicting, that it's not 100% slam dunk, that just because you have depression and anxiety before concussion does not mean that you're going to have it worse after concussion. Because you didn't have it before, doesn't mean that you're going to be immune to it. And so I do think that it's really important, because mental health carries so much stigma still in our culture, that's really important to destigmatize it and normalize it as a part of this experience of injury with concussion. And so, it's nobody's fault that you're having, emotional symptoms. It's not, a weakness. It just is what it is. And then we have to address it. And I think from the standpoint of kids who have pre-existing depression or anxiety, if they are in treatment, in therapy, on or not on medications, the fact that they are aware of the fact that they have depression and anxiety and have some skills to cope with it sometimes makes them better equipped to handle depression and anxiety after concussion. Whereas it's our kids who have never dealt with depression and anxiety before a concussion that all of a sudden experience it with a concussion and really haven't had to develop any skills to manage that. And so it can kind of cut the opposite way sometimes with that. So I think that it ends up being very much an interplay between the kind of injury that you had. It's not necessarily, an indication that you have a more severe, mechanism of injury or a more severe force per se. That may be the case in some instances, but I think from that standpoint, there's some combination of the way the injury interacts with the individual and their genetic background that they come to the injury with, and then how that all interacts that we still haven't really been able to tease out. But definitely some people struggle more, and we just don't 100% know why.
If you are experiencing emotional symptoms after concussion or caring for someone who is, it's important you prepare for those symptoms to stick around longer than just a few days.
When I was young, we thought everybody got better in a couple of days, right? And there was no big deal. And there probably are still a subset of people who do get better very quickly. And there probably is something biologic about that. But I think, with the research that's being done now, I think everyone pretty much accepts that for children, at least, children into adolescence and probably, even into like the college years, it may take up to 4 weeks to fully get 100%, or feeling like you're back to where you were before the injury. It's a gradual process. You're not in the pits the entire time, the whole 4 weeks. You're making progress, every day during those 4 weeks. But, if you're really honest with yourself, and if we're honest with ourselves, probably takes about a month to fully get better. And that would include, I think, the emotional symptoms as well for sort of, typical quote unquote average, concussions. I think a month is a reasonable time frame. When you think about it, a month is actually a long time, right? I mean, it's a long time in the life of a teenager. In some sports, it's like half season, and so I think from that standpoint, I think it's really important, like you said, to set the stage and set the expectation that everybody wants to be better in a few days. And only a few lucky people probably are for, reasons that have nothing to do with anything that they're doing. It's just how they were made, and so I think from that standpoint, to set the expectation that it may take normally a month, and that if you're in the 20 to 30%, it looks like, where you might have longer symptoms, it might take a couple of months or more, and so that kind of at least gets you in sort of like more of the marathon mode, or at least, the middle distance half marathon mode, as opposed to the 5K mode, where you're just doing your turkey trot and then you're done. And so I think that's really important for families to know, because I think parents may come in with that expectation, having grown up with this concept that concussions are done and better in a couple of days.
Noah says it wasn't until he recognized his recovery would be unpredictable and take longer than a few days that he could start to heal.
I always said that my concussion rehab process only really began when I accepted that my season was over. And that was probably about 3 weeks after my concussion, because at that point I was just thinking okay, my symptoms are getting better. I'm going to be back on the field in this date. And I remember looking at the calendar, and the college soccer season's so short, and looking at myself and being like, I want to do what's best for my health, and there's no way that I'm going to get back in time in a safe manner. So I think you just have to, one, look out for yourself first, and two, at least for me, I accepted that my season was over, and then it was a really, really hard decision, because I was like, wow, there's no way that I can come back in time. But as soon as I did that, I felt like at least for me, my recovery really started. It's obviously with concussion, it's so hard because there's no flexibility test. There isn't a certain amount of weight you have to lift, or a certain amount of miles you have to run before you can be back on the roster. It's really up to you. And in your mind, you can't decide it. There's nothing you can do. It's just whether or not you're feeling back to yourself. So on the outside, it's definitely a really, really hard thing to go through, because like I said, there's no x-ray, there's no MRI. It's just kind of, when you're ready. And so it's obviously really, really frustrating. But for me, I never risked it. I never tried to come back too soon. So my biggest advice to anyone out there is, if you've learned anything about concussions, it's don't rush the process. Because if you think you're ready, but you're not quite sure, you're probably not ready yet. You'll know to some extent when your symptoms have kind of settled down. For any athlete out there, it's definitely a really hard thing, the competitive drive to get back on the field. But you should definitely worry about your health first, and understand that it's your brain. It's not your calf. It's not your foot. It's your brain that we're talking about.
Very wise advice there from Noah. I was so naive when I suffered the concussion that ended my wrestling career 18 years ago. I treated my concussion just like I did the other injuries I'd had from wrestling and playing football. Maybe take a day off, then try to tough it out as soon as I could. Had I known recovery might take a while and I was actually doing harm by pushing through, I could have made better decisions about my health.
I do think that it is very helpful if caregivers understand that it is a cognitive emotional stamina issue.
Setting expectations for recovery is important not only for the patient, but for caregivers. It's important to remember every concussion is different, and your loved one's emotional symptoms may persist, but there are many ways you can support their recovery.
Try and anticipate, when you think they're going to need a little bit of a cognitive, emotional break from whatever activity that they're involved in, to be able to kind of recharge their cognitive, emotional, stamina bank. And then that kind of pacing is something that I think parents and caregivers, adults, teachers can help. In particular, the younger kids with. I think even the older kids, middle school and high school aged, can also have some trouble recognizing their own symptoms. I think what's difficult for them is that we then rely on them to be telling us, right? They're supposed to be telling their teacher when they need a break. They're supposed to have the insight and the ability to tell the parents when, they've overextended themselves. And yet I think it was a parent who, asked me, well, why are we expecting kids with a brain injury to do this? And so I think that that's 100%, on the money in terms of, why we really need to make sure that the people that are around kids with concussion are really supporting them. And there are definitely absolutely ways where just having someone on the outside, external to yourself, be able to give you, some feedback about, now is probably a good time to take a break, I think can be helpful for kids going through a recovery with concussion as they're trying to extend their cognitive and emotional stamina, but maybe don't have 100% the ability to be able to tell when they're about to fall off a cliff with their stamina. And that ends up, giving you that pattern of recovery, which doesn't look like a nice straight line that has a nice even slope going up in the positive direction the entire time.
You're laying in bed and you feel completely fine. And then you get out of bed and you go on the street, you hear someone honk their horn, and it feels like there was like lightning right next to you. So it's definitely a really, really hard process because it's not a straightforward path. It's not like an ACL where you have almost a notebook given to you saying this is what the rehab process is like. There's going to be ups and downs, but for the most part, you follow this and you're going to be fine. With a concussion, it can go 1,000 different paths in 1,000 different ways. So it's really, really hard. But at the end of the day, some people have it a little bit easier than others, but you're going to get through it, and it's going to be frustrating, but you're going to be fine at the end of the day.
We tell our families a lot that, it feels a lot more like a jigsaw, where basically you go up a little, down a little, up a little, down a little, up a little, down a little, but overall you're going up and you're improving. But there's definitely, that, one step forward, 2 steps back, 2 steps forward, 1 step back. And that can be very frustrating when you're in the trenches with that. But I think if you help set the stage that, it's not just a straight line of recovery, it's more like a zigzag of recovery, that helps them ride out those bumps a little bit.
When we shift our gaze to treatment, Dr. Master says it's first important to take a step back, evaluate the patient, and name what they are experiencing.
Depressive symptoms, anxious symptoms are different from actual clinical depression or clinical anxiety from a diagnosis standpoint, right? And so I think from that standpoint, I think that obviously depressive symptoms and anxiety symptoms are something that we absolutely see kids experiencing, people experiencing after concussion. It really is a matter of identifying and naming it, right? Like just recognizing that it is what it is and that's what we're experiencing, and kind of getting, that elephant in the room named and identified essentially, so that you're not dancing around it and they're not afraid to disclose it, or embarrassed. And so calling it out and naming it, I think, is a big part of that.
First step was obviously like showing my parents that I was upset, because for the first couple of weeks, for whatever reason, I was bottling it up and didn't want to let it out and didn't want to show my parents. And then also just becoming more aware of all my symptoms in general. For example, that symptom score sheet, I remember the first couple of weeks, like the scores were very low. And then as I became more in touch with my symptoms and my emotions, they got higher into like the 8s and 9s. So yeah, just as the weeks went on, I just became more, I would say, emotionally in touch and more aware of my symptoms in general. I wouldn't have gotten through it. I really don't think I would have if I didn't enable myself to kind of break the barrier and speak to my family and speak to my friends. Because most of the time, people don't know what you're going through unless you speak to them about it. So that's why, as crazy as it sounds, it was the best thing that ever happened to me, because I like to think that I'm still working on it, but it really enabled me to open up to people that I care about and just tell them, like, even like when I meet people now, I tell them all the time, like, yeah, I'm a very anxious person in general. People are like, really? Like, I never would have expected that. Like, you're so chill, you're so calm. But yeah, speaking to people, and especially when it comes to concussions, and telling them about the emotional and physical symptoms that you're having is only going to help you in your recovery. And it's only going to help them understand what you're going through.
Dr. Master says that for many people, Having social supports like friends and family is often enough to help them cope with the emotional symptoms of an acute concussion.
I think that if you look at the resilience literature, which is also, growing out there from lots of different medical fields and conditions, it will look at what are your resources that you have and really draw on those first. And so we really do encourage kids and families to recognize that this is an issue, draw on those resources that they have, and then see, in terms of the time course, if you're going on a time course and a trajectory where you're improving, day to day and week to week, then maybe you don't need to have anything more formal than that. If it starts to become clear that you're going to have a longer recovery, it's going to take a longer time, it's a little bit discouraging, there are struggles with school, not being in sports per se, then sometimes it's useful then at that point to have a professional be involved, whether it's a psychologist or some other counselor with training with depression or anxiety. And I think a lot of times what we do try to have our kids and our families feel when they're participating in this whole process with us is that having a concussion can make you feel helpless, that this entity is acting on you and you can't do anything about it. And what we like to try and do with our families is flip that script, that basically, there are small, little, but meaningful ways that you can have self-efficacy and control and drive the bus, so to speak. And so, we talk about how, right now you may be fine with the resources that you have that are supporting you. We need you to tell us when you feel like you need more help. And then we need you to also be, listening and in a relationship with us where you'll hear us when we say that maybe we think that you might need professional help, whether it's the mother or the father, or it's, us as part of the care team, or the patient themselves identifying that. And it, obviously ends up being usually some kind of combination of all three. Trying to get back to some semblance of a routine that they recognize is really important for kids. We do know increasingly that, especially for our athletes, exercise plays a really important role, right? So we all know that exercise plays an important role in general health and well-being and mental health when you don't have a concussion. And it turns out at the right time, exercise is also really helpful for concussion as well. And so again, we're not necessarily saying that kids, as soon as they have a concussion, go out and work out hard, but we're also moving away from that whole concept of kids really having to be shut down for prolonged periods of time. So I think some physical activity, we like to talk about general aerobic activity that is, again, light and manageable, not excessive, not really heavy duty training, but just, getting a little bit of a heart rate elevation, getting a little bit of a sweat going, that ends up being like a rising tide that raises all ships, right? So it makes everything in the brain better, makes your body feel better, everything. And so it's kind of like a general, tonic for the soul. And probably, obviously has other biological bases for that. So I'm sure all my exercise physiology people are rolling their eyes, at the way I'm describing it. But, exercise is in general a positive thing. And especially for our athletes, if they're used to exercising, removing exercise from them is like taking away a medication. It's like they go through withdrawal. And so I think from that standpoint, we would say try to, resume some normalcy in terms of a routine, even though it's a changed routine from before. Draw on those supports, make sure you're continuing to be connected to your social supports, whether it's your friends or your family. And then, exercise is definitely a piece of that. And even our kids who weren't athletes beforehand find it's a great opportunity and a great help to them actually to get into some nice routine of physical exercise. And then the exercise also tends to even out all of the sleep issues that I think sometimes, arises after concussion.
Noah leaned on his friends and family, but also found it helpful to speak with a therapist to cope with the anxiety and depression he felt after his concussion.
I had a couple of anxiety attacks during those 6 months of my concussion rehab. And the only way to, at least for me, I think I learned so much from those moments. And I would say coping for me, it may not be for everyone, but prior to my concussion, I never spoke to a psychiatrist or therapist. I felt weird about it. I didn't like opening up to some random person, but I would say my concussion was in October. And in January, I was having so many of these anxiety attacks and so many dark days in terms of depression and anxiety. And I was like, I felt like I needed to speak to a professional. So I remember freaking out to my mom. I was like, Mom, I got to find someone. So from then on out, there hasn't really been a month or honestly a couple of weeks have gone by that I haven't spoken to a therapist or a psychiatrist. It's really for me, it was like the best thing ever. Just I used to look forward to my sessions just half the time, and we didn't even speak about anything serious at all. But so for some people, it may seem weird that I'm saying that, but for me, it was the best thing. And that enabled me, like I said, to be more open speaking to a therapist, but most importantly, like being more open to speaking to everyone in my life. If you're at a bad point in your life, a lot of the time it feels like it can't get any worse. So there's no harm in going to speak to someone. Worst thing that happens is it's a waste. If it's a waste of an hour. But I would say most of the time you learn something, and hopefully you can spark a great relationship and a great, like, almost mentorship with someone. Doesn't even have to be a therapist. It could be a coach, a mentor, anyone. Let your guard down a little bit and just speak to people, because you'll learn so much about yourself and learn so much about other people as well. And it's really the best thing that kind of the concussion rehab process taught me, is just opening up and speaking to people.
Back with Dr. Master now to discuss the relationship between suicide and concussion.
I think it's important to actually talk about openly, both amongst clinicians and providers when we take care of kids and when we're talking about it with kids and families. It's kind of like sex. If you think it's time to talk to your kids about sex, it's probably too late, right? And so basically, it's the same with suicide, that it's never too early to bring that up, because I think if you talk about that, then in a way, you're normalizing it, you're making it so that you're setting the example that it is okay to talk about this, and it's okay for them to bring it up with you, because that's what you want. You do not want them to not bring it up with you. I think that the other thing, so certainly, just as there is, an apparent increase in depression and anxiety after concussion and mild traumatic brain injury, there appears to be a higher risk of suicide after concussion and mild traumatic brain injury. And so I think from that standpoint, that's why this should be part of every conversation. And I think one of the things that we've really talked a lot about in terms of how we think about suicide in sort of kids versus adults, and then also thinking about it in terms of sort of how you stereotypically might view it versus maybe what actually happens. One of the big issues in particular in adolescent suicide is the impulsivity aspect, the lack of frontal control. Already they're a little bit behind the 8 ball because they have not fully myelinated their frontal lobe. And so they haven't fully developed all of those executive function and inhibiting behaviors that are self-control behaviors. And so not having that fully developed and then getting a concussion, which may make that even more vulnerable, can make you vulnerable to suicide. And so that's why also when I see my patients, not only do I ask them, do they feel sad, down, or worried, or do they feel bad enough that they want to hurt themselves or anybody else? I do ask if they have access to anything dangerous like guns, other weapons, hunting knives, dangerous prescription drugs. And I just say, I ask that of everybody, right? And most people are not, shocked or negatively inclined to answer. They often appreciate it, and the kids often appreciate it, because I think it just shows that we want to care for them. Because if you look at just the suicide literature, what happens is that oftentimes, when they've done studies interviewing teenagers who attempted suicide but failed, thank goodness, there really was only a matter of maybe 30 minutes between the moment when they got the idea and then they acted on it. So there's a lot of impulsivity there. So if you're impulsive, you want to have it be a situation where they can be impulsive and yet safe and not have anything happen that is irretrievable. And that's where not having a gun in the home or having a gun that is locked and separate from the ammunition is really, really critical in terms of a safety issue. So I think from that standpoint, suicide is not common after concussion. So I certainly don't want anyone to take that away from this, but it is something that there is a higher risk, higher than the general population. And we definitely have to acknowledge that. And so I think the way that we do that is to normalize the conversation, make that conversation an open one that can be open and non-judgmental and supportive and loving and caring.
I asked Dr. Master what caregivers need to look out for in their loved ones who may be struggling after concussion.
Well, when it comes to warning signs, I think it's really challenging because there may not be any warning signs, and that's the challenge. And what I encourage parents, especially adolescents, is really to encourage open lines of communication. I think these are the times where you want to really fall back on really open lines of communication that are supportive, non-judgmental, caring, and really, not trying to really place a lot of pressure, either for the child to get better, or, get themselves out of this, that this is a process that everyone has to go through. I think that obviously, if you have that kind of open communication, hopefully the teenager will be able to tell you when they're feeling more despairing or despondent. I think that there are also other behavioral manifestations besides just verbal communication, that there is significant withdrawal from activities and friends and lack of interest in things that they used to be interested in hobbies and school and sports. And so I think all of those things would be things that we'd have them watch out for. And again, I think from that standpoint, teenagers, they can hide a lot, but they also do wear a lot on their sleeves as well. So I do think it is just a matter of parents being aware that this is a possibility. And just by being aware, I think that is more than half the battle in terms of laying the groundwork for having those conversations, paying attention. And sometimes I think it's really important for kids to realize, they may not realize themselves that they're depressed, but they need someone outside themselves to be able to say to them, you're really just not yourself right now. Can we talk about that? And so I think that those are all things that you want to be able to have those kinds of conversations about and to be looking out for so that you can act on them if needed.
If you or someone needs help coping with depression or suicidal thoughts, the National Suicide Prevention Lifeline is free and available 24/7 at 1-800-273-8255. It's easy to feel misunderstood, isolated, and alone during concussion recovery because nobody can see your injury. Not only that, but your symptoms might stop you from participating in your favorite activities. Both Noah and Dr. Master told us one of the best things you can do to cope is to open up about what you're going through.
I definitely had a lot of fear of kind of missing out on some of the great moments. One vivid example I have was the fact that after a couple big wins that we had to get into the conference tournament, and we beat a couple ranked opponents in our regular season, I couldn't even celebrate with the team in the locker room because the music was so loud. I had to sit outside with one of my assistant coaches 15, 20 feet away from the locker room, and my symptoms were still pretty bad at that point. The music was still bothering me. And I remember feeling so frustrated and so sad. Wow, it's bad enough that I can't play with my team, can't sit on the bench, but I can't even be in the locker room after with my team. But we've kind of spoke about, if you speak to your friends about it, simple things, they may be more likely to just kind of stay at home with you more often and just sit at the couch or go for a walk with you. Because early on, I remember my friends playing video games. I couldn't even sit with them on the couch. So it's definitely really, really hard if you're an athlete or even just a normal kid in college or high school. And it's hard to kind of escape it. But yeah, just people may think that, oh, Noah's changed. He's not hanging out with us as much often. But if you explain to them the reason why you don't want to go to a party or don't even want to go to someone's house to sit on the couch because your headache is still bad, they'll understand.
I think that it is very difficult because it's an invisible injury. They look fine on the outside. They're not wearing a cast of any kind that can signal, the community as to what they're going through. I think that, depending on which developmental stage you're at, it's very hard to be able to verbalize to others what you're going through. And so, again, I think that certainly in this day and age, most kids will have had some friends who've had a concussion. And so drawing on that is helpful. And I think certainly being able to share with really close friends, even if they haven't had concussions, what you're going through is really important, whether it's friends, siblings, parents. But I would really encourage the kids to, work through that and not have an anger reaction to it. I think that the anger reaction can be very self-destructive. And so we really try to validate what they're experiencing, that what they're experiencing, is, very real, not made up, and they likely are being misunderstood by many out there. And then we try and encourage them and talk about how, for instance, most of our patients and families have done a lot of education and training for their schools, right? So when they've gone through concussion, they've taught their teachers, their guidance counselors, their principals, and their athletic trainers and coaches, what it's like to go through a concussion. And so that's a real contribution and a real gift that they're giving to their school community that way. And that we understand them, that this is something that, again, I tease my patients sometimes in that they are special, but they're not that special because this is actually a very common experience that they're having.
That's right. You're not that special, and you're certainly not alone. There are so many of us who have experienced concussion and recovered and feel better than ever, like Noah, who who is now playing professional soccer in the USL. We'll leave you with a final encouraging message from Noah.
I promise you'll get to the point where you'll be completely fine, because I don't think I'm sure there are, but there's not a lot of concussions that are as traumatic as mine, and a lot of positions that involve you doing the same thing over and over again, coming out for balls at people's knees and heads and feet and things like that. So I feel like if I can do it, then most people can as well. So you just have to embrace all the little tiny wins and success moments you have, and then before you know it, you're gonna stop thinking about the word concussion, and you're gonna stop thinking that you're gonna get hurt again. You're gonna stop worrying about it. It's gonna take a lot of time, and before you know it, you're gonna be like, wow, like I felt like I've never had a concussion anymore. And the cool part about it is you're gonna learn a lot about yourself, just like with any injury, and you get to bring that with you. But then you'll stop worrying about all the bad things, and you'll be able to go on with your life and stop worrying about it before you know it.
Joining us, and for Dr. Master for making the time to share her invaluable expertise. We are so lucky to have them and all our guests. If you have any questions about what you heard today and are looking for more information on concussion or post-concussion syndrome, please visit our website, concussionfoundation.org. If you enjoyed this episode, please leave us a 5-star rating and review. Coming up in episode 5, we'll tackle the cognitive symptoms of concussion, like difficulty concentrating and multitasking. Until then, I'm Dr. Chris Nowinski. Keep fighting.